The ZIPLift IV transfer system from Innovative Medical Designs will help your medical staff effectively increase the quality of care they give while reducing the amount of strain and time to do so. Prior to viewing and utilizing this video, it is recommended that you fully assemble the ZIPLift IV transfer system. There are two primary elements to the ZIPLift system, the IV transfer pole and the ZIPLift stand. Please read and thoroughly follow the assembly instructions that are included with the package. Now that your ZIPLift IV transfer system is fully assembled, we can take a look at how to operate and get the most out of your ZIPLift IV transfer system. The first element of the ZIPLift IV transfer system is the IV transfer pole. The IV transfer pole is securely connected to the ZIPLift stand and is ready to be placed into service. To begin, clamp your IV pumps to the pole facing opposite the ZIPLift stand handles and brake pedal. Suspend IV bags from hooks similar to other IV poles. The ZIPLift IV transfer system can be positioned at the head of the patient bed to the left and right. The elevation of the IV transfer pole is easily adjustable for optimal elevation of the IV bags. Simply grab and twist the IV transfer pole release. Twist and elevate the pole to your desired height. The IV transfer pole has a range of 48 to 75 inches in height. The height of the ZIPLift stand may be adjusted to optimize the viewing of the IV pumps, IV lines, and IV bags. The ZIPLift IV transfer system is designed to hold a maximum of 44 pounds per pole. This is the equivalent of 4 to 6 channels and 4 to 6 IV bags. Additional ZIPLift IV transfer systems can be brought into the room as the care load requires. Additionally, the ZIPLift IV transfer system works with all beds and stretchers hospital-wide. The BOA is an optional accessory designed to enhance organization and safety of IV lines. The convenient cord wraps organize the power cord clutter. Additionally, other clampable items such as transport monitors can be mounted while in the room or for transport. As the patient is required to be transported, the ZIPLift IV transfer system seamlessly allows a nurse to attach the IV transfer pole to a bed without any lifting or detaching of IV pumps, lines, or bags. Using the ZIPLift is easy, and the IV transfer pole is attached to the patient bed in 5 easy steps. Step 1. Grasp both handles of the ZIPLift stand. Step 2. Align the yellow transfer pin with the bed IV socket. Step 3. Place your foot on the brake pedal. Step 4. Push the release lever down with your toe. Step 5. Push down ZIPLift stand to insert yellow transfer pin into IV socket. Continue lowering ZIPLift stand to lowest position. After completing these 5 steps, the entire IV transfer pole will have been seamlessly transferred to the patient bed. This exact process can be completed at any socket location on the corners of the patient bed. The controlled vertical action makes the transfer intuitive while utilizing good body motion. Let's look at the transport process, which utilizes the ZIPLift IV transfer system features. On transports that the patient will transfer from the bed to another surface, you will want to take the ZIPLift stand with you. Simply lift the ZIPLift stand from the floor and insert the orange pin into an open bed IV socket. It is best to do this at the foot of the bed to maintain complete patient head area access. When passing through doorways or in elevators, simply reposition the IV transfer poles to optimize the occupied footprint. Once you arrive at your destination, the process of removing the ZIPLift stand and IV transfer pole is simply the reverse of attaching it to the bed. First, remove the ZIPLift stand from the bed. Place the stand on the floor. Grasp both handles of the ZIPLift stand. Align black receiver pin with orange receiver block. Press brake pedal and then release lever with toe, and raise the IV transfer pole until fully engaged. Some lifting assistance may be necessary if the IV transfer pole is fully loaded. Remember, the ZIPLift stand is always to be returned to the lowest position, while still remaining clear of any other surrounding objects. This procedure will also eliminate a step when working in tight spaces. Once you are ready to reattach the IV transfer pole to the patient bed, simply refer to the 5-step instructions found on the ZIPLift stand. Grasp both handles of the ZIPLift stand, align respective pin with respective socket, press brake pedal, and then release lever at toe, and then lower or raise to release the IV transfer pole. The ZIPLift IV transfer system benefits to your organization are as follows. IV poles and pumps are transferred without ever being detached or lifted by the staff. Pumps remain secure during transport. Transporting through doorways and hallways is simplified. Access to patient head and airway is always unobstructed. Medical staff and patient risk is significantly reduced. Time commitment is greatly reduced. No more tangled lines. Remember, if you ever need instructions for operating the ZIPLift, just watch this video or refer to the set of 5-step instructions located on the ZIPLift stand. Congratulations! You are now ready to safely operate your ZIPLift IV transfer system for use with your current patients. Always operate your ZIPLift IV transfer system according to operation instructions. For more information and to further review operating instructions, please visit imdusa.net.